Question 1. The monitoring system demonstrates that the medical coding team is consistently applying ICD-10 codes based on historical billing patterns without a thorough review of the current payer contracts and the prevailing reimbursement model, e.g., shift towards value-based care. This approach may lead to discrepancies in reimbursement and potential compliance issues. Which of the following actions best addresses this implementation challenge and ensures adherence to best professional practices within the U.S. regulatory framework? Option A. Focus solely on general coding principles without considering specific payer requirements or the nuances of the current reimbursement model. Option B. Proactively engage with the finance department to understand the financial implications of the current reimbursement model and review payer contracts to align coding practices with reimbursement strategies. Option C. Prioritize coding speed to process claims quickly, even if it means less thorough review of payer-specific guidelines. Option D. Continue applying codes based on historical patterns, assuming that established practices will remain valid across different reimbursement models. The correct answer is B. Proactively engage with the finance department to understand the financial implications of the current reimbursement model and review payer contracts to align coding practices with reimbursement strategies. Explanation. This scenario presents a professional challenge because the medical coding team is tasked with accurately reflecting the services provided within the context of evolving healthcare reimbursement models. The challenge lies in understanding how different reimbursement models, such as fee-for-service versus value-based care, influence the selection and application of medical codes, and how this impacts the financial viability and operational efficiency of the healthcare provider. Careful judgment is required to ensure that coding practices align with the specific reimbursement model in place, thereby maximizing appropriate reimbursement while adhering to all regulatory requirements. The correct approach represents best professional practice because it involves a proactive and collaborative effort to understand the implications of the current reimbursement model on coding practices. By engaging with the finance department and reviewing payer contracts, coders can gain a comprehensive understanding of how specific codes are valued and reimbursed under the prevailing model. This ensures that coding decisions are not made in isolation, but are informed by the broader financial and contractual landscape. This aligns with the ethical obligation of medical coders to ensure accurate and compliant billing, which directly impacts patient care access and provider sustainability. Furthermore, staying abreast of changes in reimbursement models is crucial for maintaining professional competency and adhering to industry best practices as outlined by relevant professional organizations and regulatory bodies within the specified jurisdiction. An incorrect approach that focuses solely on historical coding patterns without considering the current reimbursement model is professionally unacceptable. This failure stems from a lack of adaptability and an inability to recognize that coding practices must evolve with reimbursement strategies. Such an approach risks undercoding or overcoding, leading to inappropriate reimbursement and potential compliance issues. Specifically, it could violate regulations by misrepresenting the complexity or necessity of services, leading to audits and penalties. Another incorrect approach, which involves prioritizing speed over accuracy when applying codes, is also professionally unacceptable. In any healthcare reimbursement model, accuracy is paramount. Rushing the coding process increases the likelihood of errors, which can result in claim denials, delayed payments, and significant financial repercussions for the provider. This disregard for accuracy can also lead to violations of federal and state regulations governing healthcare billing and coding, such as those enforced by the Centers for Medicare and Medicaid Services, CMS, in the U.S. A third incorrect approach, which is to ignore payer-specific coding guidelines and focus only on general coding principles, is also professionally unacceptable. While general coding principles provide a foundation, payers often have specific rules and guidelines that must be followed for successful reimbursement. Failing to adhere to these payer-specific requirements can lead to claim rejections and audits, demonstrating a lack of due diligence and potentially violating contractual agreements with payers. Professional decision-making process for similar situations should involve a systematic approach. 1. Understand the prevailing reimbursement model. Identify whether the provider is operating under a fee-for-service, value-based care, bundled payment, or capitation model. 2. Review payer contracts and guidelines. Thoroughly examine contracts with major payers to understand their specific reimbursement policies, coding requirements, and any unique guidelines. 3. Collaborate with internal departments. Engage with finance, billing, and compliance departments to gain a holistic understanding of how coding impacts revenue cycle management and regulatory adherence. 4. Stay informed about industry changes. Continuously seek out educational resources and professional development opportunities to stay updated on evolving reimbursement models and coding best practices. 5. Prioritize accuracy and compliance. Always ensure that coding decisions are accurate, supported by documentation, and compliant with all applicable regulations and payer requirements. Question 2. Risk assessment procedures indicate that a patient underwent a complex diagnostic imaging procedure requiring general anesthesia. The radiology report details the imaging findings and interpretation, while the anesthesia record documents the administration of anesthesia, patient monitoring, and recovery. A coder is tasked with assigning codes for this encounter. Which of the following approaches best reflects accurate and compliant coding practices for this scenario? Option A. Assign a single code that represents the diagnostic imaging procedure, assuming the anesthesia is inclusive. Option B. Assign separate codes for the diagnostic imaging procedure, including its specific CPT code and relevant ICD-10-CM diagnosis codes, and a distinct anesthesia CPT code with its own modifier and relevant diagnosis codes, ensuring all documentation supports each code. Option C. Assign a code for the diagnostic imaging procedure and a modifier indicating that anesthesia was provided, without a separate anesthesia code. Option D. Assign only the anesthesia CPT code, as it represents the most complex service provided to the patient. Correct answer is A. Assign a single code that represents the diagnostic imaging procedure, assuming the anesthesia is inclusive. Explanation. This scenario presents a common challenge in medical coding, where a single procedure may involve multiple distinct services, each requiring specific coding to accurately reflect the work performed and ensure appropriate reimbursement. The professional challenge lies in identifying and correctly coding each component service, particularly when they are performed by different specialists or involve specialized equipment and interpretation. Careful judgment is required to avoid undercoding or overcoding, both of which have significant regulatory and ethical implications. The correct approach represents best professional practice because it meticulously breaks down the patient encounter into its constituent parts, identifying the distinct services rendered by the radiologist, interpretation and report, and the anesthesiologist, anesthesia administration, and then applying the appropriate CPT and ICD-10-CM codes for each. The coder ensures that all services are accurately documented and billed. This adheres to the principle of specificity in coding, which is a cornerstone of regulatory compliance and ethical billing practices. Accurate coding ensures that healthcare providers are reimbursed for the services they actually provide, preventing financial loss for the provider and ensuring fair payment for complex care. This approach aligns with the principles of the AMCI Introduction to Medical Coding, I2MC curriculum, which emphasizes accurate and complete coding based on documentation. An incorrect approach would be to only code for the radiology procedure itself, without acknowledging the separate anesthesia service. This is a regulatory failure because it omits a billable service, leading to underpayment and potentially violating guidelines that require reporting all rendered services. Ethically, it is misleading as it does not fully represent the resources utilized during the patient's care. Another incorrect approach would be to assign a single, overarching code that attempts to encompass both the radiology and anesthesia services. This is a significant coding error and a regulatory failure. Such an approach lacks specificity, fails to capture the distinct work of each provider, and can lead to incorrect reimbursement. It violates the fundamental principle of coding to the highest level of specificity supported by documentation. Finally, an incorrect approach might involve coding the anesthesia service without the corresponding radiology procedure. This is also a regulatory and ethical failure. While the anesthesia was provided, it was in direct support of a specific diagnostic imaging procedure. Failing to code the primary procedure means the context for the anesthesia is missing, leading to an incomplete and potentially fraudulent claim. Professional decision-making process for similar situations should involve a thorough review of all operative reports, diagnostic imaging reports, and anesthesia records. Coders must understand the distinct roles of each healthcare professional involved and the specific services they provide. They should then consult coding guidelines and payer policies to determine the most appropriate codes for each service, ensuring that all documentation supports the chosen codes. This systematic approach, grounded in regulatory knowledge and ethical principles, is crucial for accurate and compliant medical coding. Question 3. Cost-benefit analysis shows that accurate coding of patient diagnoses significantly impacts reimbursement and resource allocation. A patient presents with a history of chronic obstructive pulmonary disease, COPD, and is admitted with acute bronchitis. The physician's documentation clearly states the acute bronchitis as the primary reason for admission, but also notes that the COPD exacerbated the severity of the bronchitis and influenced the treatment plan. Which coding approach best reflects the patient's condition and the services rendered according to the principles taught in the AMCI Introduction to Medical Coding, I2MC? Option A. Code the acute bronchitis as the primary diagnosis and the COPD as a secondary diagnosis, as the acute bronchitis was the condition that occasioned the admission and the COPD affected the management. Option B. Code only the COPD as the primary diagnosis, as it is a chronic and more severe condition. Option C. Code both acute bronchitis and COPD as primary diagnoses, as both conditions were present and treated. Option D. Code the acute bronchitis as the primary diagnosis and omit the COPD, as it is a pre-existing condition not directly causing the current admission. Correct answer is A. Code the acute bronchitis as the primary diagnosis and the COPD as a secondary diagnosis, as the acute bronchitis was the condition that occasioned the admission and the COPD affected the management. Explanation. This scenario presents a common implementation challenge in medical coding, accurately distinguishing between primary and secondary diagnoses when a patient presents with multiple conditions. The challenge lies in the coder's responsibility to reflect the patient's principal reason for the encounter and any coexisting conditions that influenced care, as per the guidelines of the AMCI Introduction to Medical Coding, I2MC framework. The professional challenge is to avoid misrepresenting the patient's condition, which can lead to inaccurate billing, suboptimal resource allocation, and flawed statistical reporting. Careful judgment is required to interpret the physician's documentation and apply the correct coding conventions. The correct approach involves a thorough review of the medical record to identify the condition that occasioned the admission or encounter. This aligns with the fundamental principle of primary diagnosis coding as taught in I2MC. The primary diagnosis is the condition chiefly responsible for the patient's visit. Secondary diagnoses are those that coexist at the time of the encounter or develop during the encounter, and that affect patient care or management. Adhering to this distinction ensures that the coding accurately reflects the patient's health status and the services provided, which is a core ethical and professional obligation for medical coders. An incorrect approach would be to code all documented conditions as primary without discerning the principal reason for the visit. This fails to follow the established hierarchy of coding and misrepresents the patient's encounter. Ethically, this can lead to inflated claims and misrepresentation of healthcare utilization. Another incorrect approach would be to only code the most severe condition, even if it was not the primary reason for the encounter. This ignores the physician's documented reason for the visit and can lead to underreporting of the actual care provided. A third incorrect approach might be to code based on assumptions or incomplete documentation, which is a direct violation of coding best practices and can lead to significant errors. The professional decision-making process for similar situations should involve a systematic review of the physician's documentation, paying close attention to the order in which conditions are listed, any explicit statements about the reason for the visit, and the impact of coexisting conditions on the treatment plan. When in doubt, coders should seek clarification from the physician. This iterative process of review, application of guidelines, and clarification ensures the highest level of coding accuracy and integrity. Question 4. The analysis reveals a patient presenting with chronic obstructive pulmonary disease, COPD, and shortness of breath. The physician's documentation states, patient with COPD, experiencing significant shortness of breath. The ICD-10-CM official guidelines for coding and reporting address the relationship between signs, symptoms, and underlying conditions. Based on these guidelines, what is the most appropriate coding approach for this scenario? Option A. Assign a code for shortness of breath only, as it is the most prominent symptom. Option B. Assign a code for COPD only, as shortness of breath is a common symptom of COPD and not separately addressed. Option C. Assign a code for COPD and a separate code for shortness of breath, as both are documented. Option D. Assign a code for COPD and a code for shortness of breath, with a query to the physician to clarify the causal relationship. The correct answer is C. Assign a code for COPD and a separate code for shortness of breath, as both are documented. Explanation. The analysis reveals a common challenge in medical coding, accurately assigning ICD-10-CM codes when a patient presents with multiple conditions that have a causal relationship, but the documentation is not entirely explicit. The professional challenge lies in interpreting the physician's documentation to determine if a condition is a sequela of another, or if it's an independent diagnosis. This requires a deep understanding of ICD-10-CM coding guidelines, particularly those pertaining to the sequencing of diagnoses and the use of combination codes. Careful judgment is required to avoid misrepresenting the patient's condition, which can impact reimbursement, quality reporting, and clinical decision-making. The correct approach represents best professional practice because it adheres strictly to the ICD-10-CM official guidelines for coding and reporting. Specifically, it prioritizes the guideline that states when a sign or symptom is routinely associated with a disease, and the physician does not indicate a separate service or treatment for the sign or symptom. The sign or symptom code should not be assigned. Furthermore, it correctly identifies and applies combination codes when they exist for conditions with a causal relationship, as instructed by the guidelines. This ensures accurate representation of the patient's health status and compliance with coding regulations. An incorrect approach that assigns separate codes for both the underlying condition and a symptom that is a direct manifestation of that condition fails to follow the ICD-10-CM guideline regarding signs and symptoms integral to a disease. This is a regulatory failure, as it violates specific coding instructions. Another incorrect approach that fails to utilize an available combination code for a causally related condition represents a failure to accurately and efficiently code the patient's diagnoses, potentially leading to underrepresentation of the complexity of the patient's condition and non-compliance with coding principles that promote specificity. A third incorrect approach that assigns a code for a condition not clearly documented as causally related to another, or as a sequela, is a failure to adhere to the principle of coding only documented conditions and relationships, which is a fundamental ethical and regulatory requirement. Professional decision-making in similar situations should involve a systematic review of the physician's documentation, cross-referencing with the ICD-10-CM alphabetic index and tabular list, and consulting the official guidelines for coding and reporting. When ambiguity exists, the coder should query the physician for clarification to ensure accurate and compliant coding. This iterative process of documentation review, guideline application, and physician query is crucial for maintaining coding integrity. Question 5. Operational review demonstrates that a physician performed a service intended to assess patient adherence to a specific medication regimen, a process that is part of a broader quality initiative but not a distinct billable procedure. Based on the AMCI Introduction to Medical Coding, I2MC framework, which category of CPT code is most appropriate for reporting this service? Option A, a Category I code. Option B, a modifier to a Category I code. Option C, a Category Roman III code. Option D, a Category Roman II code. The correct answer is D, a Category Roman II code. Explanation. This scenario presents a common challenge in medical coding, where the coder must accurately categorize services based on their nature and the available coding system. The professional challenge lies in understanding the nuances between different CPT code categories and applying them correctly to ensure accurate reimbursement and data collection. Adhering strictly to the AMCI Introduction to Medical Coding, I2MC framework, careful judgment is required to avoid miscoding, which can lead to claim denials, audits, and potential compliance issues. The correct approach involves identifying the service as a performance measure that is not a procedure or service with a unique Category I code. This aligns with the purpose of Category Roman II codes, which are supplementary tracking codes for performance measurement. By selecting a Category Roman II code, the coder ensures that the service is documented for quality improvement purposes without misrepresenting it as a distinct billable procedure. This adheres to the I2MC guidelines by accurately reflecting the nature of the service within the established coding structure. An incorrect approach would be to assign a Category I code. This is inappropriate because Category I codes represent physician services, procedures, and supplies that are generally billable and have established RVUs. If the service is not a distinct procedure or service with a unique Category I code, assigning one would misrepresent the service provided, potentially leading to incorrect billing and reimbursement. This violates the principle of accurate coding as taught in I2MC. Another incorrect approach would be to assign a Category Roman III code. Category Roman III codes are temporary CPT codes for emerging technology, services, and procedures. If the service is a well-established performance measure and not an emerging technology, using a Category Roman III code would be inaccurate and misleading. This fails to correctly categorize the service according to its established nature and purpose, as emphasized in the I2MC curriculum. The professional decision-making process should involve a thorough understanding of the patient encounter and the definitions of each CPT code category. Coders should consult coding manuals, payer guidelines, and internal policies to ensure accurate code selection. When in doubt, seeking clarification from a supervisor or coding expert is a best practice. The focus must always be on accurately reflecting the services rendered for appropriate reporting and reimbursement, as mandated by the I2MC framework. Question 6. Research into the proper coding of a patient's medical record reveals that the physician documented a history of a chronic condition that is currently stable and not actively being treated during the current encounter, but which the physician notes has implications for the patient's overall health management. According to the ICD coding guidelines applicable to the AMCI Introduction to Medical Coding, I2MC exam, what is the most appropriate coding action? Option A. Assign a less specific ICD code for the chronic condition to avoid overcoding. Option B. Do not assign any ICD code for the chronic condition as it is not the primary reason for the encounter. Option C. Assign an ICD code for the chronic condition as a secondary diagnosis if it impacts patient care or management. Option D. Assign an ICD code for the chronic condition only if it is actively being treated during the encounter. The correct answer is C. Assign an ICD code for the chronic condition as a secondary diagnosis if it impacts patient care or management. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where a provider documents a condition that is not explicitly listed as a primary diagnosis, but is clearly influencing the patient's care. The professional challenge lies in accurately reflecting the patient's condition and the services provided within the constraints of the ICD coding system, ensuring appropriate reimbursement and accurate health data. This requires careful interpretation of documentation and understanding of coding guidelines. Correct approach analysis. The correct approach involves identifying the most specific ICD code that accurately represents the documented condition, even if it's not the primary reason for the encounter, and assigning it as a secondary diagnosis if it impacts patient care or management. This aligns with the fundamental principle of ICD coding to capture the full scope of the patient's health status. The ICD official guidelines for coding and reporting, as mandated for use in the U.S. healthcare system for this exam, emphasize coding all conditions that coexist at the time of the encounter and require or affect patient care. Assigning a code that reflects the documented condition, even if it's not the principal diagnosis, ensures accurate data for statistical purposes, quality measurement, and appropriate reimbursement for services rendered in managing that condition. Incorrect approach is analysis. Failing to assign any code for the documented condition, even if it's not the principal diagnosis, is a regulatory failure. It violates the ICD official guidelines for coding and reporting, which require coding all conditions that coexist and affect patient care. This leads to incomplete and inaccurate health records, potentially impacting public health statistics and research. Assigning a code for a condition that is not documented or is only suspected but not confirmed is an ethical and regulatory failure. This misrepresents the patient's actual health status and can lead to fraudulent billing practices, violating the principles of accurate coding and honest reporting. Assigning a less specific code when a more specific one is available is a coding error that can lead to inaccurate data and potentially affect reimbursement. While not as severe as outright misrepresentation, it still falls short of best professional practice and adherence to coding specificity guidelines. Professional reasoning. Professionals should employ a systematic decision-making process when faced with such documentation. This involves 1. Thoroughly reviewing the entire medical record to understand the patient's condition and the services provided. 2. Consulting the ICD-10-CM, or relevant ICD version for the jurisdiction codebook, and its accompanying alphabetic and tabular indexes. 3. Referencing the ICD official guidelines for coding and reporting for specific instructions on sequencing and coding multiple conditions. 4. If ambiguity exists, seeking clarification from the healthcare provider. The goal is always to assign the most accurate and specific code, S, that reflect the patient's documented conditions and the care provided, adhering strictly to the established coding standards. Question 7. Examination of the data shows a physician has documented acute exacerbation of chronic obstructive pulmonary disease. When assigning the appropriate ICD-10-CM code, which aspect of the ICD code structure is most critical to ensure accurate representation of this condition? Option A. The alphanumeric nature of the code and the hierarchical arrangement of codes, ensuring selection of the most specific code available. Option B. The use of only numerical digits, as all medical conditions are represented by integers. Option C. The consistent use of a single decimal point regardless of the code's length or specificity. Option D. The sequential numbering of codes, assuming a direct numerical progression for related conditions. The correct answer is A. The alphanumeric nature of the code and the hierarchical arrangement of codes, ensuring selection of the most specific code available. Explanation. This scenario is professionally challenging because accurately identifying and assigning ICD codes requires a thorough understanding of medical documentation, coding guidelines, and the specific structure of the ICD classification system. Misinterpreting the structure or format of an ICD code can lead to incorrect coding, impacting patient records, billing accuracy, and statistical reporting. The correct approach represents best professional practice because it demonstrates a systematic and accurate application of the ICD coding structure. Understanding that ICD codes are hierarchical and alphanumeric, with specific rules for their construction, e.g., the use of placeholders, decimal points, and the sequential nature of code assignment based on specificity, is fundamental to accurate medical coding. This adherence to structural rules ensures that the most precise code is selected, reflecting the patient's diagnosis or procedure accurately. This aligns with the principles of accurate data capture and reporting mandated by regulatory frameworks governing medical coding. An incorrect approach that fails to recognize the alphanumeric nature of ICD codes and attempts to assign a purely numerical code would be a significant regulatory failure. I2MC, the standard in the U.S. for diagnosis coding, explicitly uses alphanumeric characters. Ignoring this fundamental structural element leads to invalid codes. Similarly, an approach that does not account for the hierarchical structure and the need for specificity, perhaps by selecting a broader, less specific code when a more detailed one is available and supported by documentation, would violate coding guidelines. Failure to achieve maximum specificity can lead to inaccurate reimbursement and misrepresentation of patient conditions, potentially contravening billing regulations and ethical coding standards. Another incorrect approach might involve misinterpreting the meaning of specific characters within the code, such as the use of placeholders or the significance of the decimal point, leading to the selection of an entirely wrong code category. This demonstrates a lack of understanding of the code's internal logic and structure, a critical failure in adhering to coding conventions. Professionals should employ a decision-making process that begins with a comprehensive review of the medical documentation. They must then consult the official ICD coding guidelines and the ICD code set itself. When faced with a diagnosis or procedure, the coder should systematically search for the most appropriate term, paying close attention to the alphanumeric structure, the hierarchical relationships between codes, and the requirements for specificity as indicated by the code's format, e.g., number of characters, presence of a decimal. If any ambiguity exists, consulting with a supervisor or seeking clarification from authoritative sources is essential. This methodical approach ensures compliance with regulatory requirements and upholds the integrity of medical data. Question 8. The assessment process reveals that a patient was prescribed a power-operated wheelchair for home use. The physician's documentation clearly describes the features and intended use of the wheelchair. The medical coder needs to assign the appropriate HCPCS level Roman II code for this durable medical equipment, DME. Which of the following approaches best ensures accurate coding and compliance? Option A. Assign a code based on the patient's diagnosis, assuming the payer will understand the equipment needed. Option B. Select the HCPCS level Roman II code that most accurately and specifically describes the power-operated wheelchair, including any necessary modifiers as per payer guidelines. Option C. Use a general code for mobility aids if a specific code for this exact model of wheelchair is not readily identifiable. Option D. Choose a code for a manual wheelchair, as it is also a mobility device, and the difference is minor. Correct answer is B. Select the HCPCS level Roman II code that most accurately and specifically describes the power-operated wheelchair, including any necessary modifiers as per payer guidelines. Explanation. Scenario analysis. This scenario presents a challenge in accurately coding durable medical equipment, DME, to ensure proper reimbursement and compliance with payer policies. The medical coder must navigate the specific coding guidelines for DME, which often differ from standard procedure or diagnosis coding. Misinterpreting these guidelines can lead to claim denials, audits, and potential penalties. The complexity arises from the need to identify the correct HCPCS level Roman II code that precisely describes the DME item, its function, and any necessary modifiers, all while adhering to the specific payer's coverage criteria. Correct approach analysis. The correct approach involves meticulously reviewing the physician's order and any supporting documentation to identify the specific DME item provided. This includes understanding the item's intended use and features. The coder must then consult the current HCPCS level Roman II code set, specifically looking for codes designated for DME. The selection of the most appropriate code requires understanding the nuances of each code description, ensuring it accurately reflects the equipment provided. Furthermore, applying any necessary modifiers, such as those indicating rental versus purchase or specific patient conditions, is crucial for accurate billing and compliance with payer requirements. This thorough, code-specific approach ensures that the claim accurately represents the service rendered and meets regulatory standards for DME billing. Incorrect approaches analysis. One incorrect approach is to use a generic or descriptive code that does not specifically identify the DME item. This fails to meet the specificity required by HCPCS level Roman II coding for DME and can lead to claim rejections because the payer cannot verify the item provided against their coverage policies. It also bypasses the established coding structure designed for DME, which is a regulatory failure. Another incorrect approach is to assume that a similar items code can be used if a direct match is not immediately apparent. This violates the principle of coding to the highest level of specificity and can be considered fraudulent if it leads to improper billing or reimbursement. Payer policies strictly prohibit the use of codes that do not accurately describe the equipment, and misrepresenting the DME item is an ethical and regulatory violation. A third incorrect approach is to omit necessary modifiers when they are required by payer policy for DME. Modifiers provide critical information about the service or item that affects payment or coverage. Failing to include them can result in underpayment or denial, and it represents a failure to comply with specific billing instructions, which are often dictated by regulatory guidelines for DME. Professional reasoning. Professionals should approach DME coding by prioritizing accurate identification of the equipment and its specific characteristics. This involves a systematic process of reviewing documentation, consulting the official HCPCS level Roman II code set, and understanding payer-specific guidelines for DME. When faced with ambiguity, seeking clarification from the physician or the payer is essential. This methodical approach, grounded in regulatory compliance and ethical practice, ensures accurate billing and supports the financial integrity of healthcare services. Question 9. To address the challenge of accurately reflecting patient care intensity in medical coding, a coder reviews a physician's progress note. The note details a patient encounter for a chronic condition management visit. While the physician discusses multiple aspects of the patient's health and adjusts medication, the documentation does not explicitly detail the medical decision-making complexity or the time spent on counseling. Which of the following approaches best aligns with the principles of accurate and compliant medical coding? Option A. Assign a lower-level E/M code, assuming that the lack of explicit detail indicates a less complex encounter than what might be coded. Option B. Assign a higher-level E/M code based on the assumption that managing a chronic condition with medication adjustments inherently involves significant complexity and time. Option C. Code the encounter based on the coder's personal experience with similar patient encounters, regardless of the specific documentation in the current record. Option D. Query the physician to obtain specific details regarding the medical decision-making complexity and time spent on counseling to ensure accurate code assignment. Correct answer is D. Query the physician to obtain specific details regarding the medical decision-making complexity and time spent on counseling to ensure accurate code assignment. Explanation. This scenario is professionally challenging because it requires a medical coder to balance the need for accurate and complete documentation with the ethical imperative to avoid upcoding or misrepresenting services. The risk lies in potentially inflating reimbursement by selecting codes that do not fully reflect the complexity or intensity of the services rendered, which can lead to audits, penalties, and damage to the healthcare provider's reputation. Careful judgment is required to ensure coding aligns precisely with documented services. The correct approach represents best professional practice because it adheres strictly to the principle of coding based solely on documented evidence. This aligns with the core tenets of medical coding ethics and regulatory compliance, such as those outlined by the Centers for Medicare and Medicaid Services, CMS, in the United States, which mandate that all coding must be supported by physician documentation. Accurate coding ensures appropriate reimbursement for services actually provided, preventing fraud and abuse. An incorrect approach that involves selecting a higher-level code than what is documented is a direct violation of coding guidelines and ethical standards. This constitutes upcoding, which is considered fraudulent and can result in severe penalties, including fines and exclusion from federal healthcare programs. It misrepresents the services provided, leading to improper payment and undermining the integrity of the healthcare system. Another incorrect approach, such as choosing a lower-level code than what is documented, while not fraudulent, still represents a failure in professional practice. This can lead to underpayment for services rendered, potentially impacting the provider's financial viability and their ability to offer necessary care. It also fails to accurately reflect the work performed, which can skew data used for quality reporting and resource allocation. The professional reasoning process for similar situations should involve a thorough review of the medical record, including physician notes, operative reports, and diagnostic test results. Coders must possess a strong understanding of coding conventions, guidelines, and payer-specific policies. When documentation is ambiguous or incomplete, the professional coder should query the physician for clarification rather than making assumptions or selecting codes based on perceived intent. This iterative process of review, understanding, and clarification ensures coding accuracy and compliance. Question 10. Analysis of a scenario where a physician performs a bilateral surgical procedure and the coder is tasked with selecting the appropriate HCPCS modifier to indicate this. The coder reviews the procedure code and considers several modifiers that might relate to the location or extent of the service. The coder must determine which modifier accurately reflects the bilateral nature of the procedure without duplicating information already inherent in the procedure code itself, adhering strictly to the HCPCS Level Roman II coding guidelines. Option A. Use modifier RT to indicate the right side and LT to indicate the left side separately. Option B. Use modifier -50 to indicate that a bilateral procedure was performed. Option C. Use modifier -22 to indicate that the procedure was significantly more complex than usual. Option D. Use modifier -52 to indicate that the procedure was reduced for some reason. Correct answer is B. Use modifier -50 to indicate that a bilateral procedure was performed. Explanation. This scenario presents a common challenge in medical coding, accurately applying HCPCS modifiers to reflect the true nature of a service, which directly impacts reimbursement and compliance. The professional challenge lies in understanding the nuances of modifier definitions and their specific application to the reported procedure code, ensuring that the modifier accurately describes a circumstance not already inherent in the procedure code itself. Misapplication can lead to claim denials, audits, and potential fraud or abuse investigations. The correct approach represents best professional practice because it prioritizes adherence to official coding guidelines and payer-specific policies. By consulting the HCPCS Level Roman II manual and relevant payer instructions, the coder ensures the modifier chosen accurately reflects a specific circumstance that modifies the description of the service or its payment, without duplicating information already contained within the procedure code. This meticulous attention to detail upholds the integrity of the billing process and ensures accurate payment for services rendered, aligning with regulatory requirements for truthful and accurate claim submission. An incorrect approach that involves selecting a modifier based solely on a perceived similarity to the service, without verifying its specific definition and applicability to the procedure code, is professionally unacceptable. This failure violates the fundamental principle of accurate coding and can lead to improper billing. It demonstrates a lack of due diligence in understanding coding rules and can result in financial penalties or sanctions for the provider. Another incorrect approach, such as appending a modifier that describes a different clinical scenario or patient condition than what is documented, constitutes a misrepresentation of the service provided. This is a direct violation of federal regulations, e.g., False Claims Act principles in the U.S. context and ethical coding standards, as it can lead to overpayment or payment for services not appropriately rendered under the modified circumstance. A third incorrect approach, which is to omit a required modifier when the service clearly meets the criteria for its use, is also professionally unacceptable. This omission can lead to underpayment or claim rejections, and more importantly, it fails to provide the payer with the necessary information to correctly adjudicate the claim, potentially hindering accurate data collection for healthcare analysis. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review the medical documentation to understand the service provided and the patient's condition. 2. Identify the appropriate CPT or HCPCS procedure code for the service. 3. Consult the official HCPCS Level Roman II manual for available modifiers and their precise definitions. 4. Cross-reference the chosen modifier with the selected procedure code to ensure it modifies the service as intended and is not redundant. 5. Review payer-specific policies and guidelines, as some payers may have unique requirements or restrictions regarding modifier usage. 6. Document the rationale for modifier selection in the medical record or billing notes, especially for complex or unusual circumstances. Question 11. The control framework reveals a patient encounter where the physician's documentation clearly indicates a diagnosis of a malignant neoplasm of the lung, which is the primary focus of the current treatment plan. The patient also has a documented history of severe anxiety disorder, which has been managed concurrently, and is noted to influence the patient's adherence to treatment protocols for the lung neoplasm. Based on the principles of medical coding within the specified regulatory framework, how should these conditions be coded? Option A. Code the severe anxiety disorder as the principal diagnosis and do not code the malignant neoplasm of the lung as it is being treated concurrently. Option B. Code the severe anxiety disorder as the principal diagnosis, followed by the code for the malignant neoplasm of the lung as a secondary diagnosis. Option C. Code only the malignant neoplasm of the lung as it is the more severe condition. Option D. Code the malignant neoplasm of the lung as the principal diagnosis, followed by the code for the severe anxiety disorder as a secondary diagnosis. The correct answer is D. Code the malignant neoplasm of the lung as the principal diagnosis, followed by the code for the severe anxiety disorder as a secondary diagnosis. Explanation. This scenario presents a professional challenge due to the need for precise coding of a patient's complex medical history involving both a neoplasm and a co-occurring mental disorder. Accurate coding is paramount for appropriate reimbursement, statistical tracking of disease prevalence, and ensuring the patient receives continuity of care based on their documented conditions. The challenge lies in correctly identifying the principal diagnosis and sequencing secondary diagnoses according to established coding guidelines, particularly when a mental disorder might influence the management or understanding of the neoplasm, or vice versa. The correct approach involves a thorough review of the medical documentation to determine the principal diagnosis. In this case, the neoplasm is the primary reason for the current encounter and treatment. Therefore, the neoplasm code should be sequenced first. The mental disorder, if it impacts the patient's care or management of the neoplasm, or if it is a significant comorbidity requiring specific attention during this encounter, should be coded as a secondary diagnosis. This adheres to the principle of coding the condition that occasioned the admission or encounter as the principal diagnosis, and then coding other conditions that affect patient care. This aligns with the regulatory framework for medical coding, which emphasizes accurate representation of the patient's health status and the services provided. An incorrect approach would be to prioritize the mental disorder code as the principal diagnosis simply because it is listed first in the physician's notes, without considering its relationship to the neoplasm or its role in the current encounter. This fails to follow the established coding conventions for principal diagnosis determination and misrepresents the primary reason for the patient's medical care. Another incorrect approach would be to omit the code for the mental disorder entirely, even if it significantly impacts the patient's overall health and treatment plan. This violates the ethical and regulatory requirement to code all conditions that affect patient care, leading to incomplete data and potentially inadequate treatment planning. Failing to accurately sequence the codes, for instance, by placing a secondary diagnosis before the principal diagnosis, also represents a regulatory failure as it distorts the statistical reporting and can lead to incorrect reimbursement. Professional decision-making in such situations requires a systematic process. First, identify the principal diagnosis by determining the condition that, after study, occasioned the admission or encounter. Second, review the medical record for all other conditions that coexist at the time of the admission or encounter, or that develop subsequently, and that affect patient care. Third, apply the official coding guidelines for sequencing of diagnoses, paying close attention to any specific guidelines related to neoplasms and mental disorders. Finally, ensure all documented conditions affecting patient care are coded accurately and in the correct order. Question 12. The assessment process reveals that a patient received a durable medical equipment (DME) item, specifically a custom-fitted prosthetic limb, which was not adequately described by any existing CPT code. The medical record clearly documents the item and its purpose. The coder needs to select the appropriate code for billing. Option A. Utilize the most specific HCPCS level Roman II code that accurately describes the custom-fitted prosthetic limb. Option B. Assign a generic CPT code for medical supplies as no specific CPT code exists. Option C. Report the service using a CPT code for physician consultation as the physician ordered the item. Option D. Use a less specific HCPCS level Roman II code that broadly covers prosthetic devices. The correct answer is A. Utilize the most specific HCPCS level Roman II code that accurately describes the custom-fitted prosthetic limb. Explanation. The assessment process reveals a common challenge in medical coding, accurately identifying and reporting services that fall outside the scope of CPT codes and require the use of HCPCS level Roman II codes. This scenario is professionally challenging because it demands a thorough understanding of both coding systems and the specific payer guidelines that dictate when HCPCS level Roman II codes are appropriate. Misidentification or misreporting can lead to claim denials, payment delays, and potential compliance issues. Careful judgment is required to ensure that the most specific and appropriate code is used for accurate reimbursement and data collection. The correct approach represents best professional practice because it prioritizes the use of HCPCS level Roman II codes for services and supplies not adequately described by CPT codes, as mandated by CMS and other payers. This ensures that unique medical items, services, and procedures are reported with the necessary specificity for proper adjudication and statistical tracking. Adhering to this principle aligns with the intent of the HCPCS coding system and promotes accurate billing and compliance with federal regulations. An incorrect approach that involves solely relying on CPT codes for all services, even those with established HCPCS level Roman II codes, represents a regulatory failure. This overlooks the explicit purpose of HCPCS level Roman II codes, which are designed to capture a broader range of items and services, including durable medical equipment, prosthetics, orthotics, supplies, and certain drugs and biologicals. Failing to use the correct HCPCS level Roman II code can lead to underreporting of services, inaccurate data, and potential noncompliance with payer policies. Another incorrect approach, using generic or less specific HCPCS level Roman II codes when a more precise code exists is also professionally unacceptable. This lack of specificity hinders accurate claims processing and can result in payment inaccuracies or denials. It demonstrates a failure to apply the principle of coding to the highest level of specificity, which is a fundamental tenet of accurate medical coding. The professional reasoning process for similar situations should involve a systematic review of the patient's medical record, identification of all services and supplies rendered, and a thorough search of both CPT and HCPCS level Roman II code sets. When a service or supply is not adequately described by a CPT code, the coder must consult the HCPCS level Roman II code set. If multiple HCPCS level Roman II codes appear applicable, the coder must select the most specific code that accurately reflects the service or supply provided, referencing any relevant payer guidelines or coding manuals to ensure compliance and accuracy. Question 13. What factors determine the primary definition and purpose of medical coding from the perspective of ensuring accurate financial reimbursement and regulatory compliance for healthcare providers? Option A. The coder's proficiency in using electronic health record systems. Option B. The ability of coded data to accurately reflect diagnoses and procedures for billing and claims processing. Option C. The coder's personal understanding of medical terminology and anatomy. Option D. The development of internal quality assurance metrics for coding accuracy. Correct answer is B. The ability of coded data to accurately reflect diagnoses and procedures for billing and claims processing. Explanation. The scenario presents a challenge for a medical coder tasked with understanding the fundamental purpose of medical coding from a stakeholder perspective. The core difficulty lies in recognizing that medical coding serves multiple, interconnected purposes that impact various entities within the healthcare ecosystem. A coder must grasp that their work directly influences financial reimbursement, clinical data analysis, and regulatory compliance, all of which are critical for different stakeholders. The correct approach emphasizes that the definition and purpose of medical coding are primarily determined by its role in facilitating accurate billing and reimbursement for healthcare services rendered. This aligns with the foundational principles of medical coding, which are designed to translate clinical diagnoses and procedures into standardized alphanumeric codes that payers, insurance companies, government programs can process for payment. This is a direct reflection of the regulatory framework governing healthcare transactions, ensuring that providers are compensated for their services in a transparent and auditable manner. An incorrect approach that focuses solely on the coder's personal efficiency overlooks the broader impact of their work. While efficiency is desirable, it is secondary to the accuracy and completeness of the codes, which directly affect reimbursement and compliance. This approach fails to acknowledge the primary purpose of coding as a communication tool between healthcare providers and payers. Another incorrect approach that prioritizes the creation of internal quality control reports without considering external reporting requirements misses a crucial aspect of medical coding. While internal quality is important, the external reporting of coded data to regulatory bodies and payers for reimbursement and statistical purposes is a fundamental purpose of the coding system itself. This approach neglects the essential link between coding and the financial and regulatory landscape. A third incorrect approach that centers on the coder's personal learning and skill development, while valuable for professional growth, does not define the core purpose of medical coding. The purpose of coding is external-facing, serving the needs of the healthcare system, patients, and payers, rather than solely the individual coder's development. The professional decision-making process for a medical coder in understanding the purpose of their role should begin with an analysis of the healthcare transaction lifecycle. This involves identifying all parties involved: patient, provider, payer, regulatory bodies, and understanding how coded information facilitates the flow of services and payments. The coder should then consult official coding guidelines, payer policies, and relevant healthcare regulations to ascertain the primary functions and objectives of medical coding within the established framework. This ensures that their understanding is grounded in the practical and regulatory realities of the healthcare industry. Question 14. Governance review demonstrates that a physician documented a patient encounter with a chief complaint of persistent cough and a plan to order chest X-ray and follow up. The physician's progress note also includes a brief review of systems and a physical exam. The coder is considering assigning an E/M level based on the physician's verbal indication that this was a complex case. Which approach best aligns with the current CMS E/M coding guidelines for this outpatient encounter? Option A. Evaluate the number and complexity of problems addressed, the amount and complexity of data to be reviewed and analyzed, and the risk of complications, using the physician's documentation to support the chosen level. Option B. Assign the E/M level based on the physician's subjective impression of complexity, even if the documentation for the MDM elements is minimal. Option C. Assign the E/M level based on the total time spent with the patient, as this is a primary determinant of E/M coding. Option D. Assign the E/M level based on the physician's verbal statement that the case was complex, as this reflects their clinical judgment. The correct answer is A. Evaluate the number and complexity of problems addressed, the amount and complexity of data to be reviewed and analyzed, and the risk of complications, using the physician's documentation to support the chosen level. Explanation. This scenario presents a common challenge in medical coding, accurately capturing the complexity of an evaluation and management E/M encounter based on evolving guidelines. The professional challenge lies in interpreting the nuances of the E/M documentation and applying the correct coding principles, particularly when the physician's documentation might be ambiguous or incomplete regarding the medical decision-making (MDM) elements. Careful judgment is required to ensure compliance with the Centers for Medicare and Medicaid Services (CMS) E/M guidelines, which are the sole regulatory framework for this exam. The correct approach represents best professional practice because it directly aligns with the CMS E/M coding guidelines. Specifically, it focuses on the three key components of MDM: number and complexity of problems addressed, amount and / or complexity of data to be reviewed and analyzed, and risk of complications and / or morbidity or mortality of patient management. By thoroughly reviewing the physician's documentation against these defined elements, the coder ensures the selected E/M level accurately reflects the services rendered and is justifiable under the regulations. This adherence to the established guidelines is ethically sound and legally compliant, preventing both undercoding, which deprives providers of appropriate reimbursement, and overcoding, which constitutes fraud and abuse. An incorrect approach that solely relies on the time spent during the encounter, without sufficient documentation to support the MDM elements as defined by CMS, fails to meet the regulatory requirements for E/M coding. The CMS guidelines prioritize MDM over time for outpatient E/M services, unless time is the sole determinant and is thoroughly documented. Another incorrect approach, such as assigning a higher E/M level based on the physician's subjective statement of complexity without supporting documentation for the MDM elements, is a direct violation of the guidelines. This is because the guidelines require objective evidence within the medical record to substantiate the chosen level. Furthermore, an approach that uses outdated coding guidelines or internal facility policies that contradict CMS regulations is also a failure. This demonstrates a lack of adherence to the governing regulatory framework, leading to inaccurate coding and potential compliance issues. The professional decision-making process for similar situations should involve a systematic review of the physician's documentation. First, identify the chief complaint and the history of present illness. Second, meticulously analyze the physician's assessment and plan, paying close attention to the number and complexity of the problems addressed. Third, evaluate the amount and complexity of data that was reviewed and analyzed, such as lab results, imaging reports, or consultation notes. Fourth, assess the risk of complications, morbidity, or mortality associated with the patient's management. Finally, compare these documented MDM elements against the criteria for each E/M level as defined by CMS. If documentation is insufficient for a definitive determination, the coder should query the physician for clarification, rather than making assumptions or using non-compliant methods. Question 15. Regulatory review indicates that a physician's assistant PA performed a routine follow-up visit for a patient with a stable chronic condition, documenting the encounter thoroughly. The PA's service was distinct from any direct physician supervision or involvement in the patient's care during that specific visit. When coding this encounter, what is the most appropriate approach to ensure compliance with U.S. medical coding regulations and payer policies? Option A. Code the encounter using the same E/M codes a physician would use, without specific consideration for the PA's role or payer billing rules for non-physician providers. Option B. Code the encounter using a generic administrative code that does not reflect the specific clinical service provided by the PA. Option C. Code the encounter using the appropriate evaluation and management E/M code based on the PA's documentation, reflecting the level of service provided, and ensuring the PA is recognized as a billing provider by the payer. Option D. Do not code the encounter separately, as the service was performed by a non-physician and is assumed to be included in the physician's overall patient management. Correct answer is C. Code the encounter using the appropriate evaluation and management E/M code based on the PA's documentation, reflecting the level of service provided, and ensuring the PA is recognized as a billing provider by the payer. Explanation. This scenario presents a professional challenge because accurately coding non-physician services requires a nuanced understanding of both the services rendered and the specific payer guidelines, which can vary. The medical coder must discern whether the service is independently billable by the non-physician provider or if it is considered part of a physician's service and therefore not separately reimbursable. This requires careful review of documentation, knowledge of scope of practice for different healthcare professionals, and adherence to established coding conventions and payer policies. The correct approach represents best professional practice because it prioritizes accurate representation of services provided, ensuring appropriate reimbursement while adhering to regulatory requirements. By identifying the specific non-physician provider and the service performed, and then consulting relevant coding guidelines, such as CPT or HCPCS Level Roman II, as applicable within the U.S. regulatory framework for medical coding, and payer policies, the coder ensures compliance. This approach upholds ethical coding standards by preventing upcoding or unbundling of services. An incorrect approach that involves coding the service as if it were performed by a physician without proper documentation or justification represents a significant regulatory and ethical failure. This could lead to fraudulent billing practices, violating the False Claims Act, and potentially resulting in severe penalties for the provider and the coder. Another incorrect approach, such as failing to code the service at all or coding it with a less specific code, would result in underpayment and misrepresentation of the services rendered, impacting data collection and provider revenue. Coding based solely on the physician's name without verifying the performing provider's credentials and the specific service's billability is also a failure, as it bypasses essential verification steps. Professional decision-making in such situations should involve a systematic process. First, thoroughly review the medical record to identify the service performed and the provider who rendered it. Second, determine the appropriate coding system, e.g., CPT, HCPCS Level Roman II, for the service. Third, consult specific payer guidelines and coding manuals to ascertain if the service is billable by the non-physician provider and under what conditions. Finally, apply the correct code based on this comprehensive review, ensuring all documentation supports the chosen code. Question 16. Market research demonstrates that medical coders often encounter requests for patient information from external sources. A coder receives an email from an address that appears to be from a third-party billing service, requesting specific patient demographic and insurance details to resolve a claim discrepancy. The email does not include a signed patient authorization form. What is the most appropriate course of action for the medical coder to ensure compliance with HIPAA regulations and protect patient privacy? Option A. Contact the sender to verify their identity, confirm their relationship with the patient, and inquire about the specific HIPAA-compliant basis for the disclosure, such as a business associate agreement or patient authorization, before releasing any information. Option B. Forward the email to the practice's privacy officer for review and guidance on how to proceed, without directly responding to the sender. Option C. Provide the requested demographic and insurance information, assuming that any third-party billing service has legitimate access to this data for claim resolution. Option D. Respond to the sender by stating that no patient information can be released without a signed authorization form, even if the request is for claim resolution. The correct answer is A. Contact the sender to verify their identity, confirm their relationship with the patient, and inquire about the specific HIPAA-compliant basis for the disclosure, such as a business associate agreement or patient authorization, before releasing any information. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a coder receives a request for patient information from an external source that is not immediately identifiable as a covered entity or business associate under HIPAA. The professional challenge lies in balancing the need to provide accurate and timely information for patient care or billing purposes with the absolute mandate to protect protected health information, FI, as defined by HIPAA. Misinterpreting the request or acting too quickly without proper verification can lead to significant privacy breaches and legal repercussions. Correct approach analysis. The correct approach involves a systematic verification process to determine if the requester is authorized to receive the information under HIPAA. This includes confirming the identity of the requester, their relationship to the patient, and the legal basis for the disclosure, e.g., patient authorization, treatment, payment, healthcare operations, or other permitted uses/disclosures. This aligns with the HIPAA privacy rules core principles of safeguarding PHI and ensuring disclosures are made only for permissible purposes. By seeking clarification and verifying authorization, the coder upholds their ethical and legal obligations to patient privacy. Incorrect approaches analysis. One incorrect approach is to immediately provide the requested information without any verification. This directly violates HIPAA privacy rule, which prohibits the unauthorized disclosure of PHI. Fails to establish a legitimate basis for the disclosure, such as a signed patient authorization or a permissible purpose under the rule. Another incorrect approach is to ignore the request entirely, assuming it is unauthorized. While caution is necessary, outright refusal without attempting to verify the requester's legitimacy or the purpose of the disclosure can hinder necessary patient care or legitimate business operations. It may not be compliant if the request is indeed valid under HIPAA. A third incorrect approach is to provide only partial information without understanding the full context or authorization. This can still be a violation if the partial information, when combined with other readily available information, could identify the patient and is disclosed without authorization or a permissible purpose. It demonstrates a lack of thorough understanding of what constitutes PHI and the conditions for its disclosure. Professional reasoning. Professionals should approach such requests with a mindset of verify first, disclose second. This involves establishing clear internal protocols for handling external information requests. When in doubt, the coder should consult with their privacy officer or legal counsel. The decision-making process should prioritize patient privacy and regulatory compliance, ensuring that any disclosure of PHI is documented and justifiable under HIPAA. Question 17. Compliance review shows a medical coder identified a discrepancy between the documented diagnosis and the services billed for a patient encounter. The encounter note lists a stable chronic condition, but the billed services appear to be for the evaluation and management of an acute, complex issue. What is the most appropriate next step for the coder to ensure compliance? Option A. Assign codes based on the billed services, assuming the provider intended to bill for the more complex services. Option B. Immediately escalate the discrepancy to the billing department for them to resolve with the provider. Option C. Code the encounter solely based on the documented diagnosis, ignoring the billed services as potentially erroneous. Option D. Query the healthcare provider for clarification on the discrepancy, and review the complete medical record for supporting documentation before assigning codes. The correct answer is D. Query the healthcare provider for clarification on the discrepancy and review the complete medical record for supporting documentation before assigning codes. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a coder encounters a discrepancy between documentation and the services rendered, potentially impacting accurate billing and compliance. The professional challenge lies in balancing the need for accurate coding with the ethical obligation to report services truthfully and in accordance with payer guidelines. Misinterpreting or ignoring such discrepancies can lead to significant compliance issues, including fraud and abuse allegations. Correct approach analysis. The correct approach involves a thorough investigation of the discrepancy. This includes reviewing the patient's medical record for complete documentation, consulting with the healthcare provider to clarify the services performed and the rationale for any differences, and referencing relevant coding guidelines and payer policies. This methodical process ensures that the code assigned accurately reflects the services provided, adheres to regulatory requirements, such as those enforced by CMS for Medicare/Medicaid, and upholds ethical coding standards. This aligns with the principles of accurate representation of healthcare services for reimbursement. Incorrect approach is analysis, failing to investigate the discrepancy in coding based solely on the initial encounter note, without seeking clarification or further documentation, is a failure to ensure coding accuracy and compliance. This could lead to upcoding or downcoding, violating principles of honest reporting. Coding based on assumptions about what should have been done, rather than what is documented and clarified, is a direct violation of coding ethics and regulatory requirements. This introduces bias and can lead to fraudulent billing. Escalating the issue to a supervisor without attempting initial clarification with the provider or a thorough review of the record bypasses a crucial step in the professional decision-making process and may not be the most efficient or effective resolution. While escalation is sometimes necessary, it should follow a reasonable attempt at resolution. Professional reasoning. Professionals should approach coding discrepancies with a systematic process. 1. Identify the discrepancy. 2. Review all available documentation. 3. Consult with the provider for clarification. 4. Research relevant coding guidelines and payer policies. 5. Assign the most accurate code based on the clarified information and guidelines. If resolution cannot be achieved through these steps, then appropriate escalation to a compliance officer or coding manager should occur. This structured approach ensures accuracy, compliance, and ethical practice. Question 18. The efficiency study reveals that a medical coding department is experiencing significant delays in claim submission due to the manual entry of data into their existing electronic health record (EHR) system, which lacks robust coding software integration. Which of the following strategies best addresses this challenge while adhering to best professional practices in medical coding? Option A. Adopting a standalone medical coding software that requires manual data transfer to and from the EHR. Option B. Continuing with manual data entry but hiring additional coding staff to process claims faster. Option C. Implementing an integrated medical coding software solution that interfaces directly with the EHR to automate data flow and enhance coding accuracy. Option D. Investing in a new, comprehensive EHR system without a specific plan for coding software integration. Correct answer is C. Implementing an integrated medical coding software solution that interfaces directly with the EHR to automate data flow and enhance coding accuracy. Explanation. The efficiency study reveals that a medical coding department is experiencing significant delays in claim submission due to the manual entry of data into their existing electronic health record (EHR) system, which lacks robust coding software integration. This scenario is professionally challenging because it directly impacts revenue cycle management and patient care continuity. Inaccurate or delayed coding can lead to claim denials, increased administrative burden, and potential underpayment, all of which strain departmental resources and can affect the facility's financial health. Furthermore, prolonged delays can hinder timely access to patient information for subsequent care. The correct approach, which involves implementing an integrated medical coding software solution that interfaces directly with the EHR, represents best professional practice. This approach aligns with the principles of efficient and accurate healthcare data management. Regulatory frameworks, such as those governing HIPAA in the U.S., emphasize the importance of data integrity, security, and timely processing of health information. Integrated software minimizes manual data entry errors, improves coding accuracy through built-in logic and encoder functionalities, and expedites the claim submission process. This directly supports compliance with payer requirements and reduces the risk of audit findings related to coding errors or delays. Ethically, it ensures that patient records are accurately and promptly reflected, supporting continuity of care and appropriate billing. An incorrect approach would be to continue with manual data entry, perhaps by hiring additional staff. This fails to address the root cause of the inefficiency and is not a sustainable solution. It also increases the risk of human error and does not leverage technological advancements designed to improve coding accuracy and efficiency, potentially violating principles of prudent resource management and operational effectiveness. Another incorrect approach would be to adopt a standalone coding software that does not integrate with the EHR. While it might offer some coding assistance, the lack of seamless data flow would still necessitate manual data transfer, negating many of the efficiency gains and introducing new opportunities for errors. This approach would also likely increase the administrative burden by requiring duplicate data entry and reconciliation between systems, failing to optimize the workflow as intended by modern coding software solutions. This could lead to inconsistencies in patient data, impacting both clinical and financial aspects of care. A third incorrect approach would be to invest in a new EHR system without a clear strategy for coding software integration. This is a costly and disruptive solution that might not directly address the coding-specific inefficiencies. Without a plan for how coding will be handled within the new system, the department could find itself facing similar or even new challenges, demonstrating a failure to conduct a thorough needs assessment and implement a targeted solution. A professional decision-making process for similar situations should involve a comprehensive workflow analysis to identify bottlenecks. This should be followed by a thorough evaluation of available technology solutions, focusing on their ability to integrate with existing systems and meet specific departmental needs. A cost-benefit analysis, considering both financial implications and improvements in efficiency, accuracy, and compliance, is crucial. Engaging coding staff in the evaluation process ensures that the chosen solution is practical and user-friendly, fostering adoption and maximizing its benefits. Adherence to regulatory requirements and ethical considerations regarding data privacy and accuracy should guide every step of the decision-making process. Question 19. The audit findings indicate a potential discrepancy in the coding of a recent patient encounter, specifically regarding the assignment of a secondary diagnosis code. The coder is unsure if the initial coding was accurate based on the provided documentation and the audit's preliminary assessment. What is the most appropriate course of action for the medical coder in this situation? Option A. Discuss the audit findings and the specific patient case with other coders in the department to get their opinions on how to proceed, without directly involving the physician. Option B. Thoroughly review the original medical documentation, consult with the attending physician for clarification on the patient's condition and the services provided, and verify the accuracy of the assigned codes against current coding guidelines. Option C. Immediately adjust the secondary diagnosis code to align with the audit's suggestion, assuming the audit is always correct. Option D. Overlook the audit finding due to a heavy workload, assuming it is a minor oversight that will not significantly impact billing or reporting. The correct answer is B. Thoroughly review the original medical documentation, consult with the attending physician for clarification on the patient's condition and the services provided, and verify the accuracy of the assigned codes against current coding guidelines. Explanation. This scenario presents a professional challenge because it requires the medical coder to balance accuracy in coding with the potential for financial implications and the need to maintain patient privacy and data integrity. The audit findings highlight a discrepancy that could impact reimbursement and potentially indicate a systemic issue in the coding process. Careful judgment is required to determine the root cause and implement appropriate corrective actions without compromising ethical standards or regulatory compliance. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based investigation. By reviewing the original documentation, consulting with the physician, and verifying coding guidelines, the coder ensures that the codes assigned accurately reflect the patient's condition and services rendered. This meticulous process upholds the integrity of medical records, supports accurate billing, and complies with regulations such as the Health Insurance Portability and Accountability Act, HIPAA, which mandates the protection of patient health information and the accuracy of healthcare transactions. Adhering to established coding conventions and seeking clarification from the provider demonstrates a commitment to professional standards and ethical practice. An incorrect approach that involves immediately correcting the codes without investigation fails to identify the underlying reason for the discrepancy. This could lead to repeated errors and does not address potential training needs or system flaws. It also risks assigning incorrect codes if the initial audit finding was based on a misunderstanding of the documentation or coding rules, potentially leading to fraudulent billing. Another incorrect approach, which involves ignoring the audit findings due to time constraints, is a direct violation of professional responsibility and could have serious consequences. It undermines the purpose of audits, which is to ensure accuracy and compliance. This inaction could lead to significant financial penalties, reputational damage for the healthcare facility, and a breakdown in the trust placed in the coding department. It also fails to protect patient data and ensure accurate reporting of healthcare services. A further incorrect approach, which involves discussing the audit findings with colleagues not involved in the audit or the patient's care, constitutes a breach of patient confidentiality and HIPAA regulations. This is an egregious ethical and regulatory failure, as protected health information must be handled with the utmost discretion. Such a breach erodes trust and can lead to severe legal repercussions. The professional reasoning process for similar situations should involve a systematic approach. First, understand the nature of the audit finding and its potential impact. Second, gather all relevant documentation and information. Third, consult with appropriate parties, such as the physician or other healthcare providers, to clarify any ambiguities. Fourth, apply the correct coding guidelines and principles. Fifth, document all actions taken and the rationale behind them. Finally, implement any necessary corrective actions or training to prevent future occurrences, always prioritizing accuracy, compliance, and ethical conduct. Question 20. System analysis indicates a patient received general anesthesia for a complex abdominal surgery that included a laparoscopic cholecystectomy and a subsequent intraoperative cholangiogram. Following the surgery, the patient also underwent a diagnostic upper gastrointestinal endoscopy with biopsy. Based on the AMCI Introduction to Medical Coding, I2MC framework, which approach most accurately reflects the coding requirements for these distinct services. Option A. Code the general anesthesia for the abdominal surgery, the laparoscopic cholecystectomy, the intraoperative cholangiogram, and the diagnostic upper gastrointestinal endoscopy with biopsy, ensuring appropriate anesthesia modifiers and radiology/endoscopy codes are applied. Option B. Code a single anesthesia code for the entire surgical encounter and a single radiology code for all imaging performed, without specific modifiers. Option C. Code the general anesthesia for the abdominal surgery and the laparoscopic cholecystectomy, and then code the intraoperative cholangiogram and the upper gastrointestinal endoscopy with biopsy using generic codes without specific modifiers. Option D. Code only the general anesthesia for the abdominal surgery and the laparoscopic cholecystectomy, assuming the cholangiogram and endoscopy are bundled services. The correct answer is A. Code the general anesthesia for the abdominal surgery, the laparoscopic cholecystectomy, the intraoperative cholangiogram, and the diagnostic upper gastrointestinal endoscopy with biopsy, ensuring appropriate anesthesia modifiers and radiology/endoscopy codes are applied. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a patient undergoes multiple distinct procedures within the same specialty, requiring the coder to accurately identify and sequence the appropriate codes for each service. The complexity arises from understanding the nuances of bundled services versus separately billable procedures, especially within anesthesia and radiology, where modifiers and specific service descriptions are critical for accurate reimbursement and compliance. The professional challenge lies in ensuring all services rendered are captured without overcoding or undercoding, adhering strictly to the AMCI Introduction to Medical Coding, I2MC guidelines. Correct approach analysis. The correct approach involves a meticulous review of the operative report and associated documentation to identify each distinct anesthesia and radiology service performed. This includes recognizing when a modifier is necessary to indicate a separate procedure or a specific circumstance of the service, as per I2MC guidelines. For anesthesia, this might involve identifying the type of anesthesia, the surgical procedure it supported, and any qualifying circumstances. For radiology, it involves identifying the specific imaging modality, the anatomical area imaged, and whether contrast agents or special procedures were involved. The best professional practice is to code each distinct service with its most specific code and apply appropriate modifiers as dictated by the I2MC framework, ensuring compliance with all regulatory requirements for reporting multiple procedures. Incorrect approaches analysis. One incorrect approach would be to only code the primary anesthesia service and the most significant radiology procedure, assuming other services are bundled. This fails to capture all billable services, leading to under-reimbursement and a failure to accurately reflect the work performed, which is a regulatory and ethical failure in accurately reporting patient care. Another incorrect approach would be to assign a generic code for each specialty without differentiating the specific types of anesthesia or radiology performed. This lacks specificity and does not comply with the I2MC's emphasis on precise coding, potentially leading to claim denials or audits due to inaccurate reporting. A third incorrect approach would be to apply modifiers incorrectly, such as using a modifier for a bilateral procedure when only a unilateral service was performed, or failing to use a modifier when a separate service was rendered. This directly violates coding guidelines and can result in fraudulent claims, a severe regulatory and ethical breach. Professional reasoning. Professionals should approach this scenario by first understanding the scope of services documented. They must then consult the I2MC coding manuals and any relevant payer policies to identify the correct ICD-10-CM diagnosis codes and CPT procedure codes for each distinct service. The decision-making process involves a systematic breakdown of the operative report, identifying each anesthesia and radiology component. Crucially, the coder must determine if services are distinct or bundled based on established coding conventions and payer rules. Applying modifiers correctly is paramount to accurately represent the services rendered and ensure compliance. If ambiguity exists, consulting with a supervisor or subject matter expert is a critical step in professional decision-making.